How do you evaluate a patient with a thyroid swelling? Or we could call it a thyroid nodule. Well, one thing needs to be understood. A large number of patients have thyroid nodules. Maybe 30% of people at the age of 30 and maybe 50% of people at the age of 50 will have some nodules. But that doesn't mean that all these are cancers. More than 95% of these people would be benign condition. So if you evaluate all people at the age of 50 with an ultrasound, you may find 50% of the people having some kind of a nodule. But then, we also need to know whether these nodules that are persisting in the neck or in the thyroid are cancers or not. So how do we go about evaluating them? Well, there are set criteria at which we start evaluating a thyroid nodule. The 3 steps of evaluation is, after complete examination, the first would be to do a thorough thyroid profile, that is the thyroid hormone profile, performing the T3, T4 and the thyroid stimulating hormone test. The next would be a radiological evaluation with an ultrasound. In case of thyroid, the ultrasound is an excellent tool. If used by an excellent clinician, it gives the best data possible about the type of nodule, the consistency of nodule, if it's hard or cystic or fluid filled, and the structures around it. It almost gives you a presumptive diagnosis. The next step would be to confirm the diagnosis with a fine needle aspiration cytology, in which a thin needle, maybe ultrasound guided, can be used to evaluate the thyroid nodule. A few cells are taken and they are examined under the microscope. This gives us an idea whether the nodule that we are evaluating is a benign condition or if it's a malignant condition. And if it's a malignant condition, a further evaluation and treatment can follow.